So good morning, good afternoon, depending on where you are in what part of the country. But welcome to the Community Pharmacy More Profit Roundtable. My name's Breck Rice. I'll be one of your hosts today. We have a number of amazing presenters that will be here today. But I have had the privilege of working with community pharmacies now for over 20 years. I love the industry. I'll do everything I can to help community pharmacies be more profitable, and that's the whole reason for this podcast series and this program to help community pharmacies see some of the tremendous products, services that are there to help community pharmacies. So, um, again, my name is Breck. I'm the co-founder of ServRx. We'll hear a little bit about ServRx here in just a minute. And everything that I do in my own company, ServRx, and with the podcast series is to bypass the PBMs to help community pharmacies make more profit. And so that's what this series is about, as well as I also host the PBM Reform podcast on the Pharmacy Podcast Network, try to make positive changes there as well, and do anything that I possibly can to fight against the big PBM and insurance mafia to help community pharmacies. And it's a slow process when you're fighting against those big giants, but we are making some progress. Little tiny, steps, kind of like chiseling away at the iceberg, and as fast as we're working, the Titanic's still going to hit that iceberg, and so that's why I do this other program to help bypass the PBMs. So everything we talk about today will be something that will help bring more profit to your pharmacy, again, by bypassing the PBMs. Now, I believe that one third of all of your revenue should come from non-dispensing. And as you can see by this chart, the independent pharmacies have all their eggs, or 91% of their eggs, in that dispensing basket. So you need to expand outside of just dispensing in order to be profitable. And in fact, a recent study showed that about one-fourth of all medications dispensed at a community pharmacy actually walk out the door below your acquisition cost of the drug. I know I'm preaching to the choir. You guys are in the trenches and understand this. So, what can you do to bring more revenue in that isn't dispensing? And so that's this whole program today, and we want to bring you solutions to do that very thing. Now, when I was a little boy, I got the opportunity to live up in British Columbia, Canada, for a while, and of course, the national sport there is hockey. So I got to love hockey. Got to play Pee Wee League hockey when I was a kid, and it was a lot of fun because you felt indestructible with all those pads on. I think the pads weighed more than the kid. But one of my favorite all-time players is Wayne Gretzky, and I love this quote. When he was asked what made him such a good hockey player, he said that he skates to where the puck is going to be, not where it's been. We need to take that same philosophy in community pharmacy. We need to go where the profits are going, not where they have been. They have been in dispensing, yeah, in last 2 decades ago, but now your profit margin from 36% has gone away. You're lucky if you're making 3 to 5% profit margin. And so that's why we want to help community pharmacies go to where those profits are going. Let me show a short explainer video about the ServRx program. You're all probably already contracted with us, and if you're not utilizing us, please reach out to us so we can help you utilize it. It is a free service to community pharmacies.
An injured worker comes into your pharmacy. What do? Do they have a PBM card? Who is their carrier? Will I have to make a bunch of calls to find out? Will I get paid? And if I get paid, will it even cover the cost of the drugs? Don't worry, just send the claim to ServRx. They will do all the work, guarantee payments, and you will even make more. Less work and more money. What do you have to lose? You are probably already contracted through your PSAO. All you need to do is enroll. www.servrx.com.
So I usually have Will Shaw cover this. I didn't don't know if Will was available this morning. So Will's one of my team members, and he is a great asset to ServRx. But I'll cover this real quick for you. You know, this again is bypassing the PBMs in order to get fair reimbursements on your workers' compensation scripts. And we realize that you don't have a lot, may only be 1 or 2% of all your claims, but if you can process them to the ServRx bin, you're always going to make triple or quadruple what the PBMs would pay you for those same medications. So you can see here by this chart, meloxicam is a great example. PBMs are only paying you $4 and $5 when you should be getting well over $90. And in some states, it's over $100 for a month's supply of just that one medication. So you can see that a few work comp scripts processed through ServRx can really move the needle for your pharmacy. And we realized also that the PSAOs that you participate with do put you into some networks, and it's kind of an all or nothing situation with some PBMs like Optum, for instance. If you want the 65 million lives of United Healthcare, Optum kind of holds you hostage and says, okay, all or nothing. You've got to take Catamaran, Cypress Care, all of their other crappy PBM networks. And so we understand that, we get that, but still about 50% of the walk-in patients that have a work-related script to be filled should be able to go through the ServRx bin for those higher reimbursements. So here to help. If you're not enrolled with us, please get enrolled. So want to welcome next up to the stage. I'm not sure if Jonathan's traveling this week. Not sure that I saw him come in. But BreathRx, I think most of you are familiar with this amazing product. And Jonathan, if you are here, just speak up. And I apologize. I'm a little disorganized this morning with touching base with all of our presenters because exciting news. I'm getting a new grandbaby today, so I've been busy with my daughter and helping out with that. So didn't reach out to everyone to make sure they would be here, but I know enough about this product because it's amazing. It is a functional breath mint and that is taking the community pharmacy by storm. Amazing product that has a great margin for you. It's that 100% markup. Getting 50% margin on the product. Some amazing flavors. They're coming out with a new mango tahim, which I'm excited for that to launch. And in fact, their blue raspberry was the winner of the mint and gum category at a recent conference. So amazing product you should check into. And I'll leave the contact information in the chat if you haven't brought this in yet. What I love about this, when Jonathan talks about if you're doing immunizations at your pharmacy and somebody is a little bit nervous about getting a shot, like a kid maybe not wanting their flu shot, you give them a little bit of this, and while that party's going on in their mouth, you can go ahead and give them the shot, and they don't even know that they got the shot. Then just give them the rest of the bottle, and they'll think, man, I'm going back there for all of my immunizations. So kind of a fun product to carry at your pharmacy. And I'm sure Jonathan will be at the upcoming conference in New Orleans. If anyone's going to be attending, ServRx will be there as well. Come by and see us. We're at booth 1300, and then Jonathan will be there too as well with samples of BreathRx. Next up to the stage, I know that Scott is at a conference right now, GermsRx, but let me show you this amazing product.
Have you worried about the germs and bacteria your children pick up at school or while playing outside, just to bring those same germs back into the house? Or you have an older parent whose immune system doesn't fight as hard as it once did? Introducing myshield sanitizing wipes and sanitizing body spray, a more effective answer in the fight against germs and bacteria, available in large or travel size formats. Our cutting-edge antimicrobial nanotechnology, Zetrasil, creates a microscopic bonded barrier on your skin and other surfaces, keeping you safe from 99.9% of common germs for up to 4 hours. Our sanitizing wipes are water-based and stay saturated for longer, allowing you to cover more surfaces per wipe with our proprietary virus and bacteria-killing solution. With a pack of these wipes in your bag, it's easy and even enjoyable to sanitize surfaces and skin everywhere you go. They're safe for children, safe for pets, and safe for you. If you prefer a spray to a wipe, our sanitizing body spray includes all the same virus and bacteria killing science as our wipes do. Simply spray anywhere to sanitize your skin or your clothes, avoiding your eyes and mouth for up to 4-hour protection from viruses and bacteria. MyShield's sanitizing body spray is available in 2 ounces, 16 ounces, and 1 or 5-gallon sizes. The sanitizing wipes come in 2 resealable pouches, from a travel size of 20 wipes or a large size of 50. Come get your MyShield on and visit GermsRx.com to discover how our innovative products can shield you from harmful diseases and infections.
So Scott Lampier would normally be here to talk about this amazing product. I got to tell you, I will not travel without it. It, it it's a must for me. I'll take it with me whenever I go on a plane or anything that I've got to be in public spaces. If the FDA says that it lasts up to 4 hours of protection, it means you're getting probably 5 or 6 hours. And Scott's not here today because he's at a provider conference right now, educating healthcare providers, doctors, a lot of family practitioners about this because they all have the alcohol-based hand sanitizers in their office, and the efficacy of that alcohol-based hand sanitizer is like 30 seconds. You literally at once the alcohol dries up, its pathogen protection is gone. Where this amazing product gives you protection up to 4 hours. So I'll leave the contact information in the chat for you so that you can get more information about this amazing product. So again, I don't know that Philip is here with good iodine. I'll leave the contact information. This is an amazing, not only is it immune boosting program, but it helps anyone on Synthroid. So all of your patients that are on Synthroid, only about 10% of them are actually getting the benefit that they need. This will help them actually produce their own T3, T4 hormone. And so it's an amazing program that he's rolling out, and I'll leave information for you to contact him. If you have, most pharmacies have a couple hundred patients on Synthroid, so you might want to have this as a good supplement. Just like anyone that's taking a statin should be on a CoQ 10, the same thing. Any patient on the Synthroid should be on this. Next up, I do know that my good friend Chris is here to tell us more about the pharmacy marketplace. So I'm so glad you're here, Chris, so I don't have to do all the talking today.
Hey, Rick, man, you're going to be busy today. Congratulations on the
Yeah,
new
thank you.
family member. That's great. Yeah. So what we're doing, guys, is we are helping the drugstores maximize their gross profit by understanding all the rebate guardrails that they've agreed to with their prime vendor agreement. We also work with secondary suppliers to show you some opportunities based on your dispensing information to take advantage of. But really, it's all about like balancing and finding the sweet spot in terms of your sourcing. So that is one piece of our business. Another piece that I'm really excited about, and Brick, yeah, I think you're going to be excited about. Brick mentioned how 1/4 of the prescriptions going out that door are underwater right now. So that's something we've really looked into in terms of working with the different states around the underwater acquisition laws. So we're developing an automation program to help drugstores have those laws, take advantage of them. So in our pilot state, Tennessee, we're working with pharmacies to identify and help automate the process of filing complaints, both internal to the PBM and then to the state insurance commission. So if you guys are interested in learning more about that, feel free to reach out or about the sourcing feature. It's all tied into one bundle for our software. I'll leave my information in the chat. Thanks, Brett.
That is amazing, Chris. And when can I book you to come tell us all about that on the PBM Reform
Yeah.
podcast? Let's get you on that.
Let's do it. You just let me know and we'll do it.
Okay, sounds good. Thank you. Appreciate your support, Chris. And And what an amazing opportunity for community pharmacies to really make sure that your dollar is going as far as it needs to, that you're getting the right purchasing power. And then now to hear about that, I'm super excited about that. Thanks, Chris. Appreciate it. So next up to the stage, I know that our title sponsor today, RX OneShop, Doug is normally here to present, and luckily he gets to be on a cruise right now. So I want to tell you that real quick that we appreciate RX OneShop for their sponsorship to this podcast, but it is an amazing program for community pharmacies just to be able to see that you're getting the best price on products out there. So they do the shopping, they find the great deals so that you can save. And the 30,000 NDCs. The one product that I was super excited about that they carry is the G7 uh, um, Dexcom glucose monitor. So that's the top of the line Dexcom, and it's one of the less expensive prices I've seen anywhere from a wholesaler is to get those. Why is that interesting to me? Because you'll hear a little later on in the program today about clinical services where you can actually get compensation for helping patients set up their glucose monitors and do a whole continuous glucose monitoring program that's super exciting. So that's one reason why I was excited about them having such a good price on their G7. So I'll leave contact information in the chat. So next up, I want to invite Jessica. I believe Jessica's here today to tell us more about Real Value RX.
Yes, hi Breck, and everyone, and I apologize because I'm having issues with my camera today. So,
No worries.
um, but yeah, we are a secondary wholesaler, and I know that there are many secondaries to choose from. But what makes Real Value RX unique is we really focus on trying to bring profitability to our pharmacies because, as Breck mentioned earlier, you used to be able to make a healthy 35% margin. Now you're lucky if you make 3 to 5%. So we are full line and we do bring your regular, scripts, your retail meds, and we have fantastic pricing on that on your everyday meds. But we also focus on flexible dosing items. And these are the items that really bring you nice profitability to your pharmacy. But more importantly, a lot of them are better therapies for your patients. Better therapies, unique items, and then also existing items that you're familiar with on the day to day, but different strengths so that you can kind of have that flexible dosing option. And a lot of doctors are very responsive to that. Aside from that, we also have, we don't require contracts, we don't have volume requirements, we do have hassle-free returns, flexible payment terms. We really try to bring everything to you because we just want to bring profitability to your pharmacy. That's what we thrive in. So we are full line with the flexible dosing items, but also, your regular retail meds. So that's pretty much it in a nutshell. There is no cost to set up. We don't require minimum order requirements. So I'd love, if you're interested, you can sign up and kind of browse our catalog and see if it's worth it. But I will tell you, our pricing is very aggressive across the board. I'll leave my info, in the chat. So if anybody would like to reach out.
Yeah, thank you, Jessica. And I will attest to the pricing being so good that I know several pharmacies that use them as a primary wholesaler, not a secondary. So
Correct.
check into their pricing. And Jessica, do you still do an analysis too for pharmacies where you look at what they're buying and kind of run the analysis?
Absolutely. We do price bids. I have customers that send in their dispense data or they'll just send me bids, whatever you're comfortable with. And we absolutely do a price analysis. Definitely, if you're ordering in volume, we'll give you a further discount. We do it all. We really do. We try to acclimate to, your order preference and style. And, we just want to make pharmacies money. So
Awesome. Well,
anything we can do to help.
thank you so much. Appreciate you being here today. So,
Thank
all right.
you.
So next up, just tell you real quickly about same-day delivery. I know that there's a lot of um, uh, programs out there where you can use, like DoorDash type people to do deliveries for your pharmacy. Make sure you're utilizing a HIPAA compliant delivery solution if you're not doing it yourself. And this might be a good solution for you. It's called Hypr, and it's a true flat rate. So even though you may be seeing that somebody has a flat rate for you, they usually have a fuel surcharge, and then they have another tax on top of that. And so even though their flat rate says that it's $9, it ends up being $12 per delivery. This is a true flat rate. In most cities, some of the LA areas, New York, it's a little more expensive. Um, but for most cities, you'd be at a $7.95 flat rate. I'll leave contact information in the chat if you are interested in getting more information about that. So, for the last couple of years, you've heard me preaching about getting, diversifying, getting your pharmacy doing more than just dispensing. I had the slide earlier talking about that you need to have at least 1/3 of your revenue coming from non-dispensing. Well, clinical really is the future for community pharmacy. You can ask anyone in pharmacy at the highest levels with big grocery store chains down the rung. Community pharmacy needs this, whether you're ready for it or not, it's coming. And so I wanted to outline a 3-step process to do this successfully. There are more wrong ways to do it than right ways. Step one, we're going to hear about just in a minute here from the Vice President of Sales and Marketing from a company called Remote Care Today. And that is this brand new CMS covered CPT code, Remote Therapeutic Monitoring, RTM. So RTM is step one. It is a way for you to provide additional clinical solutions to your senior patient population. And what pharmacy doesn't have a growing senior population? This will be a way for you to help them with the two main things. It addresses the two main concerns that seniors have, and that is loss of memory and loss of balance. So we'll hear about that. The best part about the RTM program and Brain Health Plus is that there's no cost to the pharmacy. There's no startup cost at all for you to do that. Step two is getting set up to do medical billing and expanding your scope of services to do programs like I was talking about with or alluding to with the continuous glucose monitoring. So step two is getting in network with the independent pharmacy provider network in order to get compensated for the time that you're spending with patients, setting up their glucose monitoring, and then doing a monthly review with them. Tremendous opportunity. That program will take things like the flu shots that you're giving this time of year and turn that into a preventative health visit. So instead of just getting a $17, $18, $19 reimbursement, you can actually get closer to $85 reimbursement when it's a well care visit. So we're going to hear a little bit about that. And then step three, I'm just going to touch on because that's not for every pharmacy. Step three is Brim Wellness. It's the full brick and mortar clinic that you would need a footprint for of 10, 12, 10 by 12 square feet. So it may not work for every community pharmacy, but it is an opportunity for you. Now you can do step one all by itself and just kind of start getting into more clinical. You can do step one and step two together. You just can't do step three without step two. Step two is the prerequisite. You've got to have collaborating provider working with you or providers. I like pharmacies that have multiple collaborating providers working with them because that means more patients are being directed into your pharmacy. But yeah, you've got to have that and be in the payer networks in order to do the full brick and mortar step three. So without any further ado, I want to turn some time over to, actually, I'm going to show a little video first and then we'll turn some time over to.
As an independent pharmacist, you already know your patients count on you. And with reimbursement challenges and tight margins, finding new revenue streams that actually help your patients is more important than ever. That's why we're happy to introduce you to Brain Health Plus, a remote therapeutic monitoring program, RTM, covered by Medicare Part B and most Medicare Advantage plans designed to improve memory, balance, and cognitive function in just 5 to 10 minutes a day. It does this with fun exercises and games that stimulate the brain, increasing neuroplasticity. Your patients can access Brain Health Plus from their smartphone, tablet, or computer. It's a one-of-a-kind RTM platform that offers engaging, fun, and clinically proven activities to improve cognitive health, prevent falls, and helps your senior patients stay independent longer. We're talking about daily brain games, interactive motion sensing exercises, motivational health content, medication management tools like being able to scan your medicines right into the system, reminders of when to take medicines, potential drug-to-drug interactions, and even geofencing alerts, so loved ones are notified if a patient visits the ER or hospital. Every patient also gets a 30-second biometric facial scan they can do at home so they can scan their face and track their health as often as they wish. This amazing technology lets them track important health vitals like blood pressure, heart rate, and oxygen levels with 96% accuracy. Done with a smartphone or even a computer, it keeps patients motivated and engaged without replacing their medical care. And here's the best part. We do it all for you. You get a fully turnkey solution. Flyers, posters, bag stuffers, and patient onboarding handled entirely by us. We even do all the Medicare billing. No added staff time, no upfront cost. In fact, no cost to you ever. Just real results for your patients, such as a clinically proven decrease in falls and better memory. And you can earn administrative service fees for simply reviewing monthly patient progress reports for each participating patient, which will significantly add additional profits to your bottom line. Brain Health Plus, easy for you, powerful for your patients, and great for your pharmacy. Click the Book a Call button to schedule a demo and bring it to your pharmacy today.
George Veronis, Vice President
Yes.
of Sales and Marketing for Remote Care Today.
Well, thanks, Breck, and everybody that's on listening. I really appreciate the 1 or 2 minutes I get. But reality of it is, Breck came to me, like you said, a year or so ago, and he's been preaching the clinical services and medical billing for a long time. And he always mentioned there's a cost to that. And that's why I said, well, these pharmacies could implement this RTM program. It's absolutely no cost to them up front at all, any cost. And we help their senior patients with the two biggest issues they're always concerned about, and that's falling or cognitive issues. And, Medicare Plan B and Advantage cover both of this, which is great. And then we needed administrative people to help us with this. And we were going to doctors. And Breck said, why don't we bring this to the pharmacy? So we're able to pay a $25 per patient per month administrative fee, which if we have 100 patients on this, that's $2,500. I say 200, 5,000 a month of what we say pure profit. It's actually a 1-minute assessment you have to do at the end of each month for each of these patients. So it's a great way to generate pure profit in your pharmacy. You help all your patients. They thank you profusely for these. It's the two most concerns, as I said. And then you could either use that profit for whatever you want, or you can use it for the other programs that Breck has with the medical billing, which is an easy way to go with that, which is obviously there's more money to be made in that. We probably showed this to 300 pharmacies. I think we've had less than a handful not want to implement it. We're actually just kicking off the main program with the RTM this month. So it's a great time to be involved. And what we recommend is, get a 20-minute appointment with myself, and I'll go through it in detail with you, answer all your questions, and you'll see how strong the program is. But this is the future, and the seniors like this RTM. And again, it's all profit for you. So Breck, thanks for the introduction, and I'll put my information in the chat, and those that want to reach out to me, that'd be great.
All right. Thank you, George. Appreciate it.
Yep.
Next up to the stage, the Independent Pharmacy Provider Network. This is the fastest growing community health collaboration in the country. And as what, George alluded to, his program can help pay for this implementation. But unlike some of the other credentialing companies that were out there charging thousands and thousands of dollars for pharmacies to try to get set up with payers, and most of them didn't ever get across the finish line, IPPN is a lot less expensive, and it's completely turnkey. They're not just leaving you, all right, here's the networks you can bill to, but yeah, they do everything, including providing the the billing platform. So I want to introduce you to the CEO of the IPPN, or Independent Pharmacy Provider Network, Ray Vono, and invite Ray up to the stage to tell you about his amazing program.
Well, thank you very much, Breck. Yeah, the Independent Pharmacy Provider Network was established to help pharmacies, in particular independent pharmacies, to be able to generate additional revenue outside of what they may be doing currently within the pharmacy. So, for instance, Brett gave the example of an RPM service or or even RTM is outside of what the pharmacy may be generating in revenue for revenue currently. But IPPN, again, comes in with a software package that allows for full documentation for these programs, comes in with a collaborative practice agreement, a provider that you can count on to be that collaborating provider. We also do direct marketing to providers within the community, within the pharmacy community. So we'll get a list of providers that we can actually market to directly to the pharmacy. And then we also provide, through our collaborating doctors, we provide the contracting, so you're able to bill. Our model is very easy for any pharmacy to pick up, to start generating money right away, and that's because we come in with all of these keys to success. We have our software, we have the collaborating practice agreement, we already have a provider in your state that's actually going to see these patients, and we also have the payers within every state. Some states we have more, some states we have less, but we cover the whole country with our provider and payer network. So those are the keys to success for us. And then as we continue to develop and grow, we have other tools. The RPM is something that pharmacies can do. RTM is something that pharmacies can do. They can engage their patients, they can enroll their patients, and they can get paid for doing those types of things. We've also launched a new program called the RX Direct Care. And RX Direct Care is a concierge style pharmacy program. We have some pharmacies now that have started to launch it. They're submitting the text messages to every single pharmacy, or excuse me, every single patient within their pharmacy. And the response has been very good. It hasn't been overwhelming. We haven't fully engaged, but because of just the sheer number of pharmacies that are interested right now, we're kind of going through the processes. We're allowing these pharmacies to do direct marketing, and we're going to be adding additional opportunities for RX Direct Care. Some of the benefits for the patient, it's essentially giving the patient some tools like a PGX test for the patient. It's included in the program. The pharmacy can leverage that and use it to be able to generate more encounters. It also sets the pharmacy up to be able to do clinical billing. In addition to that, any encounter that's documented or that's entered through RX Direct Care can go through what's called bin billing, direct bin billing. So they can actually gain know that they're getting paid right away based on the eligibility of the patient. So these are just some of the things that we do. And I think I'm most excited about RX Direct Care and the ability for them to be able to do bin billing and pay right away, because that makes it simple. Patient comes in, they need a prescription, they need to see a doctor, they utilize the IPPN collaborating doctor relationship. The patient gets their script, patient utilizes that pharmacy on an ongoing basis. Even in addition to that, when you're doing the PGX, that scenario also lends itself to additional visits with that pharmacy. So we're always geared towards more revenue, more profitability, and also just being able to generate revenue as a community care center rather than just a place where I go and pick up my scripts.
Yeah. So, Ray, would this be the equivalent of concierge medicine, but just affordable concierge program?
It is. The response has been tremendous. It's anywhere from $45 to $85 depending on the program per month. The patient pays. The pharmacy doesn't have to collect any money. Anytime they see the patient, they submit a claim. They can do it right from their pharmacy software, and also directly from IPPN as well. It's enabled that way through our clearinghouse with IPPN. It also does a it kind of sets the table for additional services where it provides access through that pharmacy to other clinical services, and it's really managed through the pharmacy. And the pharmacy is usually the most accessible healthcare provider in their community. They're
Yep.
open longer hours. They're in a more convenient location. So this is just leveraging some of these benefits.
Yeah, I always I missed a slide here. Sorry. There you covered this already, but yeah, I always have talked about your program, Ray, as being really a win-win-win. You know, the patient wins obviously because of the faster, easier access going to a community pharmacy. They're not waiting around for 2 weeks or a month to get in to see their primary care provider. But the primary care providers are still winning because they're still managing the care plan and getting compensated for it. And then, of course, it's improving their quality measurements because now those care gaps are getting filled. But the pharmacy wins big time with IPPN because approximately 67% of all the bill charges stay with the pharmacy, even after
Right.
paying the provider and everyone else. And then now adding on to that, this private payer network, which is, man, pharmacy, $40 every patient encounter is tremendous. You know, how many Medicare scripts do you have to fill at your pharmacy to make up $40? And so
Right.
that's amazing. So thank
That's
you
right.
very much for sharing and being a
Thank you.
part of the
Thanks, Brett.
podcast. Please put your contact information in the chat. You need to schedule a meeting and see the full demo on this if you haven't yet. So let me go
Thank you.
next to Brim Wellness. I don't know if Michael Phillips was able to join. He did have another meeting. He was going to try to join late, but let me cover this. This is the brick and mortar HIPAA compliant clinical room in your pharmacy, and it's a three-legged stool. The first leg of the stool is the build out of your clinic and equipment, and then managing that clinic for you. And the second leg of the stool is a pretty interesting concept. It's the talent exchange. Imagine it's kind of like Uber, but for medical staff. So you may want to provide certain things like doing lab work, which is coming to these clinics where you can actually do on-site lab work. Well, that's going to require a phlebotomist. Well, you don't need to have a phlebotomist there every day. So you just post the day that you're doing labs, and a phlebotomist says, "Oh yeah, that shift's only, 10 miles from me. I'll accept that shift." So it's kind of like I said, Uber for medical staff. The third leg of the stool is what I'm most excited about for community pharmacy because it is the financial vehicle that can help you build out your clinic. And when you pay back the pharmacy fund, you become a cooperative member of the fund. And so now not only are you helping the next community pharmacy set up their clinic, but you're now earning interest on that money in the fund. So at some point in time, you hope to be able to hand your pharmacy down to the next generation of community pharmacists and retire someday. Well, this could be part of your retirement. So pretty excited about that opportunity. So next up, we're going to kind of shift gears a little bit, and we want to get into ways to actually save you money and make more profit through some tremendous strategies here. First, we're going to talk about taxes. I think you all know you're paying too much in taxes.
Be overpaying your taxes by 20% to 40%. What's the problem? Well, if your company is a successful pass-through entity, like a sub-S corporation, LLC, sole proprietorship, or partnership, much of your income is taxed at the top individual rate, over 50% in some states. If your company is a C corporation, you are missing out on the benefits of the sub-S structure. Most business owners set their companies up as they were told, not knowing they could take advantage of a lot more tax breaks if they were properly structured and used the right strategies. It's nobody's fault. It takes a combination of specialized legal knowledge and specialized accounting knowledge to maximize business and personal tax advantages. We have that specialized legal and accounting knowledge and, typically, reduce the taxes of business owners by 20 to 40% if they take advantage of the strategies that we offer and help them implement. Who are we? We are a tax law consulting firm that, since 2002, has specialized in tax strategy optimization and has served over 3,800 small to mid-sized businesses in all 50 states. Our managing partner is an attorney, a master's of law and taxation, a member of the tax court bar, and a CPA. We bring all that big corporation knowledge and experience to the SMB world. Our strategies usually create savings every year and last the life of the business. Those strategies include entity and corporate structuring, retirement planning, succession planning, estate planning, education planning, and other advanced approaches. You also need to know what we are not. We are not going to replace your financial advisor, insurance advisor, corporate or estate attorney, accountant, bookkeeper, or CPA, and we are not going to work in the gray area. Everything we do is by the book, statutory in nature, and in compliance with the law. We get paid based on only your first-year tax savings, and during your complementary analysis, you will have an estimate of your savings before you ever commit. If you would like to learn how much your taxes can be reduced, email or call the number below for a preliminary discussion.
Richard Torrell?
Hey, Brett, can you hear me?
I can, yes.
Very good. Thank you very much. Yes, I think that really kind of said it all. We're a law firm. We've been around for almost 30 years. We've been working with businesses across the United States and working with Breck to serve the independent pharmacies. One of the things that we offer is no requirements. We'll do an analysis to identify the minimum amount of taxes that you can save before you ever have to commit to anything. So if you feel like you're paying too much in taxes, as Breck says, who doesn't, then we can help you. So let us know. You've got my information in the chat, and you can get me through Breck at any time. Take care. Have a great week.
Thank you, Richard. And now next up to the stage, I'm going to stop sharing my screen so that Dr. Demar Lewis can share his screen if he would like. Let me give you permission there. And he can take you through his amazing program to help you improve your profits through his consulting techniques. So, Dr. Lewis, great to see you.
Thank you, Breck. Yeah, and a great program as always. Can you guys see my screen? It should say Profit Acceleration, Profit Simulator at the top.
It's come up now. Yeah, thank you.
Okay. Okay, great. So my background, I'm a pharmacist, been a pharmacist for 40 plus years. And so you guys can do the math of how old I am. I'm not gonna share that. But we've pharmacy, as I think Jessica had mentioned and Breck has talked about through this program, is changed a lot in those 40 plus years. And we're now at a point where you really have to decide whether you're going to take business or you're going to deny it, because as you know, Breck talked about, and I think Chris talked about earlier, there are prescriptions that basically you're making no money, which really means you're losing money on them. And so I've found a system to allow pharmacy owners to choose what business they're going to take and what profit impact it's going to have. So what we have up on the screen right now is the profit simulator. And this is just kind of an estimate of what the benefit of it is. One of the things that we talk about is being able to double your profits. So I'm going to show you that, but then I'm going to show you how you can integrate some of the things that have been talked about today to see where you can have an impact and what you want to do based on priority, and create a plan. That's probably the takeaway from this is that we create a profit plan that you implement over 6 to 12 months, and you see a 2 to 4-fold increase in profitability. So anyway, we've got a pharmacy here. It's generating about $5 million in annual revenue. And gross profit somewhere around 36%. A healthy pharmacy is somewhere between about 45 to 60% gross profit. Net profit for a healthy pharmacy is somewhere between 20 and 40%. So at 3%, this pharmacy is making roughly about $150,000. That is not healthy. So most of their money is being spent on obviously drug purchases, and they're getting somewhere between 25 and maybe 50 cents on the dollar for a prescription, if that, if not just, a flat amount. So looking at the simulator, one of the biggest areas that we can help a pharmacy owner is looking at costs. So looking at costs related to purchasing, looking at costs related to contracts that they have for utilities and rent, but and having agreements based on volume, and then that goes into wholesalers, and they're, talking to or listening to the talk today. There were several wholesalers that have discount programs. So if we want to achieve just a discount of 5%, and our current annual profit is roughly around $150,000, but we get a 5% reduction, which is child's play, especially for a pharmacy owner, because it really can be 10 to 15%. And then likewise, if we look at pricing, and especially pricing that is related to cash, and increase that by 5.6%, again, not very big. We've actually more than doubled the annual profit. And this shows you, this is something that we can do within the first 30 to 60 days, so that the profits are dropping to the bottom line right away, because it's not affected by sales. If we then go and just look at the other areas, most pharmacies don't have a market dominating position. Market dominating position is really talking about who is their customer, and what is their competitive advantage to serving that customer, and what is their compelling offer. Well, I can think of 3 companies today that provide that compelling offer to help a pharmacy set themselves apart from the big box pharmacies. And so if we come up with market dominating position, compelling offer, if we look at adding products and services such as remote patient care monitoring, clinical services, and we just do those things, and we look for an additional 5% in those areas. And then the last thing being not joint ventures, but a drip campaign, reaching out and staying top of mind with the customer. We can see that we've had almost a 5-fold increase in profitability just with those areas. And so what I would ask is that if you could just spend 45 minutes, we can look at your actual data and come up with a plan at no additional charge. And whether you decide to work with me, or you want to do it on your own, we'll generate a report to give you the kind of the roadmap to achieve those types of profits. Thank you, Breck.
Yeah, thank you, Dr. Lewis. Appreciate it. So I appreciate everyone who has presented today on the More Profit Roundtable. I have put a lot of information up in the chat for you. You'll see a list of all the approved services and products for the roundtable have been included. I will also include that in the show notes for the podcast for anyone that's listening to the replay or listening to the podcast on wherever you get your podcast, Spotify, Apple. I've also left a link at in the notes here too for the YouTube channel, so you can get all of the replays. It's just simply youtube.com/healthcare_disruptors, and you can get all the replays there and a lot of other really good information for you too as well. So, but do want to open it up for any questions that any of our pharmacists might have for any of the presenters today, and or if there's questions directly to me. Wshaw from my team is here now if you've got any questions about ServRx that he can address for you. But do any of our pharmacy guests today have any questions for any of the programs or any of the presenters? I'm going to go ahead and stop the recording here real quick. But yeah, I want to thank everybody first before we open it up for everyone who has participated, for your time today on this this roundtable, for all of our presenters. And we're here to help any way we can. We want to help community pharmacies be more profitable. I absolutely love community pharmacies, and I'll do whatever I can to help you be successful.